that appointment right now. Well, here to explain more is Dr. Andrew Wong with Hartford HealthCare Medical Group. Thank you very much for joining us this afternoon.
Hi, Ken. Happy to be here.
Yes, of course, you're a primary care physician. Why get that regular checkup right now?
Yeah, so to preface my answer, let me tell you about two of my patients who during the pandemic came in regularly for their appointments, even at the beginning of the pandemic when we were stressed and anxious. And today, one of those patients is 100 years old. The other patient is turning 100 in 2 weeks. So they're doing something right. And I think it's understanding the importance of preventative care. It's finding and diagnosing medical conditions like high blood pressure, high cholesterol, hypothyroidism, and high sugars before they really become real medical issues. The more time we have to treat those conditions, the more options we have, and you and your provider can come up with an effective solution to take care of those things.
I think you said it best. Preventative care is very important. So at what age should a healthy young adult start seeing a primary care physician?
Yeah, so I recommend as soon as you're finished with your pediatrician, and that's usually going to be the ages between 16 to 18, and of course there's exceptions to that. But it's important to establish care with a primary care provider, I think within a year after leaving your pediatrician. And even though our patients are going to be healthy in those populations, it's again about preventative care. It's a really timely age for learning good habits, cutting back on nighttime electronics, the importance of getting a good night's rest, the importance of regular exercise and staying away from unhealthy foods. There's the Buddhist saying, we make our habits the first 30 years of our life, and after that our habits make us. So it's a really important time to start building those habits to carry with you.
I like that statement. Our habits make us after 30 years. They most certainly do. Now, during this pandemic, we've all been dealing with a lot of things. What about mental health? Is that something that you've been seeing there in your practice?
Yeah, 100%. Even in our own offices, a lot of medical providers and staff are really just feeling the stress and anxiety from the unknown. And we empathize with our patients as well. So there's not just the health issues from the COVID itself, but there's all the lifestyle adjustments and disruptions. It could be working from home. When I worked from home, I said, oh, hey, this wasn't everything it's cut out to be. My refrigerator's 2 feet away, so I ended up eating a lot more. There's a natural boundary that we have as human beings that we separate work from home, and all of a sudden those boundaries get mixed. There's problems with the quarantine, and if our kids are quarantined, we can't just hire grandma or a babysitter to come in because they're being quarantined. So there's that huge issue as well. I can't go to work because my kids need to stay home. And there's the missing human element. We need to, as human beings, meet face-to-face with other people, meet with friends, exercise. It's what I call natural meditation that's really missing. So I try to do mental health screens on all my patients because we can't have true health without mental and physical good health.
All right. Thank you very much, Dr. Andrew Wong with the Hartford HealthCare Medical Group. Thanks for joining us.